Okay, great. We're recording this tonight because as we have been going through, we've been hosting these webinars or these trainings every month, and I want to make sure they're accessible to more people. So if you joined us tonight, you can go back and watch the last couple months of videos. So if you're interested in learning more, you can go to our YouTube channel to see more of these. Um, okay, so whenever you're ready, Nalita, I'll let you share your screen, but I'm going to go ahead and just start introducing Promises and yourself. So to start us off, Nalita Makikoti, I believe I'm
Yes.
saying that right.
Yes.
She's been with us for 8 years. She's over at the Washburn House location in Massachusetts. So again, she's been there for 8 years, and she is our clinical director of Promises Outpatient Services. And she's a licensed clinical social worker, seasoned therapist, community advocate, and comes to us with decades of experience across clinical education and ministry settings. So I'm really glad that she's here tonight. I know a lot of you that might be family members sitting here in a webinar for the first time. Maybe it's the first time your loved one is in treatment. I think that these trainings are really important because, you get the opportunity to meet someone like your loved one is likely going to be meeting. So if you're someone sitting here with a loved one at Washburn House, they're likely going to work with Nalita. If you're at the Ranch, Tennessee, there's someone just like her that's going to be trusted with the care of your loved one too. So oh, great, you're sharing. So if you want to, Nalita, I'm going to pause. If you want to X out of the box in the bottom right corner, do you see that extra zoom box that's going on?
Let's see. There? Yeah.
No, I still see my face twice. Yeah, right there. That's perfect.
Okay. There you go. Yeah.
Thank you. Okay, and you can go to the next slide. I'm still introducing you.
Okay, great.
Okay, great. So she also specializes in working with individuals who are experiencing both substance use and mental health challenges. As we know, they likely go together, and she's especially passionate about serving underserved and marginalized communities. So in her role, she provides outpatient therapy to both individual and groups, blending evidence-based clinical approaches with faith-informed principles to support holistic healing. So her work is grounded in compassion, cultural humanity, and integrity. She focuses on helping clients reclaim their stories, build resilience, and strengthen their relationships because at the end of the day, I think we're all on a mission to just understand ourselves and the people that we love better, right? So her clinical experience includes supporting people dealing with anxiety, depression, anger, low self-esteem, domestic violence, and substance abuse recovery, along with other complex behavioral health concerns. And she also serves as the president of Net of Compassion, a homeless outreach community that she's been involved with for more than 15 years. She's a published author, and her work on the importance of including a spiritual component in clinical strategies was published in 2020. So I'm really happy that you're here today. If you want to go to the next slide, I'm also going to introduce Promises a bit more. A lot of you, if you're sitting here, you are already familiar with our family of programs. But if you are not, if you're new to the webinars, if you're new to Promises, we have 7 locations across the country. And while each program maybe offers something a little bit different flair for the location, for example, the Ranch, Tennessee offers equine therapy and it offers a sexual recovery program. Washburn House, where Nalita is, they offer the longest curriculum of care in the state. So you can actually be there for up to 9 months of curriculum, which is pretty amazing. Down in Texas, where I am, Promises Brazos Valley was one of the first mental health residential programs in the state. Promises Dallas Fort Worth and Promises Atlanta, both of those just opened last year. And ending with the Right Step Houston, it's been serving that community for Texans. Oh, hello, Kat. Since 1990, which is only a few years older than me. So they've been around a long time. But across the board, all of this to say, all of our clinical integrity is the same. So wherever you're at, wherever your loved one is sitting tonight, just know that it's all based in the same curriculum and compassionate care. So our mission at Promises is to really hold each other accountable and hold our clients to the highest standard of care we can give. So just know that they're in good hands. And again, we're really glad that you made the decision to join us tonight. You can go to the next slide. So next week, we are offering these trainings every month. It's the second Tuesday of the month. On the third Tuesday of the month, I hope I'm getting this right. The third Tuesday of the month is our family support group. So that is going to be more of an open format. So next week, Bill Anderson from our Promises Atlanta location. He'll be with you every month in these support groups. It's basically just an open space for families to talk about what they're experiencing. And also, if you have any questions for us at Promises about what your loved one might be experiencing. It also gives you the opportunity to kind of digest what Nalita goes over tonight, and then you can bring your questions back next week. And it's again just a place where you can kind of feel less alone on the road to recovery. So tonight, like I said, your microphone is muted, your camera is turned off. If you have questions, you can put them in the chat. But for next week, you're able to raise your hand and really talk to someone that can help you and guide you a little bit more. So that is a separate registration. I can put that link in the chat so you all can register for that now if you'd like to join us. But that again is the same week every single month. So you can register for all of them at once if that makes you feel better too. So 5 o'clock, same time next week. Okay, I think you can go to the next slide. I think that's it for me. Amazing. Okay, I'll let you take it from here. Thank you all for being here. I'm in the chat if you need anything.
Great. Good evening, everyone, and thank you all for joining tonight. And tonight we're going to dive into understanding the factors that influence behaviors, right? Why do our loved ones or our friends act the way they do? And so it's important to understand in this way we can help and we can be more empathetic and compassionate, right? So there's a famous quote by Norman Vincent Peale, and he says, "Change your thoughts and you change your world." And that is very true. However, if you're dealing with trauma and you have unprocessed emotions, emotions that are not regulated, and you have difficulty with substance abuse, which usually they go hand in hand. Substance abuse and trauma, co-occurring disorders usually go hand in hand. And if they're not dealt with appropriately, this is very difficult to do, right? Okay. So the introduction. Tonight we're going to be talking about definition of mental health, why mental health is essential, the key reasons, common mental health challenges, factors that influence thoughts and behaviors, protective factors that promote healthy behavior, and outcomes and long-term impact. Mental health is the state of emotional, psychological, and social well-being that influences how individuals think, feel, act, handle stress, and relate to others. It is essential at all life stages, affecting decision-making and daily functioning. It exists on a continuum influenced by genetics, experiences, and environment. Why it's essential? It's essential because it dictates how we think, feel, act, and cope with life stresses, directly influencing our overall well-being. It supports physical health, fosters strong relationships, and enables productivity, allowing people to realize their potential. Good mental health is fundamental for managing life's challenges, making sound decisions, and thriving daily. So the key reasons why it's important. Physical health connection. So mental health is closely linked to physical health. Poor mental health can increase risk for heart disease, stroke, and diabetes, to name a few. Stress management. It builds emotional resilience, helps individuals cope with daily stress and life challenges. Relationship quality. It improves emotional regulation. It supports healthier communication and stronger relationships. Productivity and focus. It enhances concentration and decision making. It improves performance at school and work. And quality of life. It promotes self-esteem and life satisfaction. It encourages positive contributions to family and community. So the key point is that mental health exists on a continuum. It's not simply the absence of illness, but a state of overall well-being and the ability to thrive. Okay, so there's there's mental health challenges, and these are just few. Depression, stress, mood disorders, anxiety disorders, trauma-related disorders, personality disorders, and substance use disorders. Now, there are factors. There's factors that may contribute to these disorders. First of all, we're going to talk about the amygdala, right? The amygdala stores and recalls events from 0 to 3 years old, and it plays a central role in processing emotions, detecting threats, forming emotional memories. So in the middle of our brain here is where the amygdala sits, right? And someone perhaps, perhaps they had, or they lived in a home, dysfunctional home where the mom was addicted, let's say, to crack cocaine. And when they were a child, mom, for the first 3 years of their life, was addicted to crack cocaine and did not hold the baby. She fed the baby, but she did not hold the baby. And how could that be, right? I was reading an article once where a mom that was addicted to crack cocaine, she would feed the baby by plopping the milk, the pillow with the milk, right? And then she would go to the other room and she would, continue to use. And that happened for about 3 to 4 years. Um, Her child now was 15 years old, and he did not get involved in any types of sports. He wouldn't come to the dinner table. He was just very isolated, had a flat affect all the time. He wouldn't get involved in any, with any of his peers at school. And there's just a lot of lots of time where she just tried to find out what was wrong with her son, why her son, had such disconnect with the family. And finally, she meets with a therapist, and they interviewed her and they asked her, what were you doing, or how was your life like when this child had 0 to 3 years old? And she mentioned, that she had been addicted to crack cocaine at the time, and so forth and so forth. And by the end of the session, the therapist said to her, your son may be suffering from what's called an attachment disorder, because judgment free, he said, because of your illness, right? Um, the cocaine hijacked your brain, and so what happened was this child was not getting the affection that he needed at the time, and so forth. And he had an attachment disorder, and so when he got older, right? If, let's say, his wife says to him, why can't you hold me? Why can't you bring me flowers? Why are you so cold all the time? This is going to have obviously a profound effect on relationships, right? And he's not able to do that because he was not what? He was not nurtured, right? He wasn't neglected in the sense that he was given food, but he was not nurtured because he was not held at the time he was fed. So all of these things can have a profound effect, right? Also, family, right? Communication problems, abandonment, non existent or absent family, neglect, controlling, overprotective parents. All of this can cause profound, right? Um, so, self esteem issues, rebelliousness. It could cause someone to be anxious all the time, right? Physical, mental, or verbal abuse. Increased sensitivity to perceived danger, heightened fear response, hypervigilance, always feeling on guard, increased anxiety and emotional reactivity, reduced hippocampal volume, difficulty with memory and concentration, challenges learning new information, increased vulnerability to stress. The opinions of others, bullying, it can cause emotional regulation challenges. It can impact the prefrontal cortex, the area that helps regulate emotions and decision making, increased anxiety, difficulty controlling emotions, impulsive reactions, negative thinking patterns, trouble problem solving during stress. Media, right? Violent content can trigger the brain stress system, activation of the hypothalamic pituitary adrenal axis, which may increase levels of stress, increasing cortisol hormone, increased anxiety, sleep disturbances, heightened alertness or fear responses, desensitization to violence, changes in emotional regulation. Music. Music with violent or hostile lyrics can temporarily increase aggressive thoughts or feelings. The American Psychological Association studies have shown that exposure to aggressive lyrics can lead to increased hostile thoughts, lower tolerance for frustration, increases in aggressive reactions, increased curiosity toward riskier activities. Technology. So, overexposure to technology, phones, social media, constant notifications, gaming, streaming, can lead to changes in attention, in reward processing, sleep, and emotional regulation in the brain. These effects happen because the brain adapts to repeated stimulation through neuroplasticity. So our brains are neuroplastic. And what does that mean? Our brains can build new pathways. Right now, you are all learning, right? And so your brain is building new pathways right now, right? And so our brains are changing, right? Substance abuse. What are the factors there? Substance abuse can change the brain chemistry, increase risk of anxiety and depression, mental health disorders, impaired thinking and decision making, trauma and emotional regulation problems. Also, the brain's reward system becomes rewired, right? We talked about the neuroplasticity in the brain. It becomes rewired and forms strong habit and memory form circuits form, right? Reducing self-control and decision making. Stress-dense systems become overactive. And again, the brain plasticity makes the changes last, right? So the good thing though is that these can be, they can the you can rewire the brain, right, to positive, right? So we're talking about the negative factors, but we're going to talk about positive factors and what you can do to help the brain to, regain, right? And so outcomes, right? These are the negative outcomes. If someone does not get treated, let's say for alcoholism, this is what can happen, right? Korsakoff syndrome is a brain disorder caused by severe vitamin B1 thiamine deficiency, often linked to long-term alcohol misuse. The key effects on the brain, so it damages memory, shrinks the brain, difficulty forming new memories and learning new information, brain cell damage because neurons cannot produce enough energy without thiamine, confabulation, where people unknowingly create stories to fill memory gaps, develops after Wernicke encephalopathy if the vitamin deficiency is not treated. So some brain recovery is possible if a person stops drinking, improves nutrition, and gets treatment early. So here, if we see the picture here, it said this is a 43-year-old, right? They're both 43-year-old, and they both, obviously, they died of alcoholism. Well, I'm sorry, one died of alcoholism, the other did not. So if you see here, here's the normal brain, right? And on the right-hand side, here is someone with Wernicke encephalopathy. And you see here, this picture is depicting the areas of the brain that have shrunk, right? And so when this happens, obviously it's going to cause, this person is in a vegetative state, right? They're not able to complete any of the ADLs, and they are, unable to recall basically anything, right? But again, if this is diagnosed early, the brain can recover if a person stops drinking and improves nutrition and gets treatment early. But at this stage, it's non-reversible, okay? Outcomes, again, a normal liver weighs 3 to 3.5 pounds, but heavy long-term alcohol can make it grow much longer, sometimes up to 22 pounds, right? So here is a normal liver, and here is a liver that has, you know, increased to 22 pounds, right? This happens in stages. So alcohol fatty liver disease, fat builds up in liver cells, causing the liver to enlarge. Alcohol hepatitis, the liver becomes inflamed and damaged. Now, cirrhosis is a long-term damage that causes scar tissue and liver failure. All right. In short, heavy alcohol use makes the liver fill with fat. It becomes inflamed and enlarged greatly, eventually leading to serious liver damage. Right. So again, if this is diagnosed early on, the liver does have, can heal itself, right? The liver has about 500 functions, and miraculously it can actually heal itself within 2 weeks. Now, scar tissue will not heal. Once the liver is scarred and there is cirrhosis, that part of the liver will not heal. However, again, the liver has a mechanism by which in 2 weeks the liver can heal, right? So the amygdala, right? The outcomes on the brain, the amygdala becomes overactive, making the brain more sensitive to danger and causing anxiety, fear, and hypervigilance. The hippocampus may shrink or function less effectively, which can lead to memory loss, memory problems, and flashbacks. The prefrontal cortex becomes less active during stress, making it harder to think clearly, control emotions, or to calm down. The stress system, right? Trauma disrupts stress hormones like cortisol, keeping the body in constant fight or flight state. Overall, trauma shifts the brain towards survival mode, where threat detection is stronger than rational thinking. However, the brain can heal over time through therapy, support, and healthy coping strategies. So if you have a loved one who's, always fighting, always arguing, they forget things. You ask them, why did you lose the keys again? Or, I told you not to do this. And it's a constant, like, I don't know what to do with him because he just does not understand. It really is, it is a rewiring of the brain. If they're using substances or they have unresolved trauma, right? And they're always anxious, right? They may be always anxious. It's because of that, right? They they process emotions differently, right? Because their brain has gone through trauma, right? And when you have trauma linked with substance abuse, it's worse, right? Um, and so it's important to understand that so that we be, now that we're more understanding, we can be more compassionate. Some people think, oh, they're using drugs because they are not making clear decisions, right? They can make better decisions. Why do they continue doing the things that they do if they know it's going to harm them, right? But it's not as easy. It's not as easy to just say, you can say I want to stop, but it's not as easy to do, right? Because the brain is hijacked by the substance, right? So now let's talk about protective factors. Parental affection. Benefits include increased confidence exploring the world, right? Better emotional regulation, healthier relationships later in life, secure attachment supports long-term mental health. Brain plasticity and learning. Affection encourages the brain's ability to grow and adapt through neuroplasticity, right? This leads to stronger neural pathways, improved cognitive development, and better social and emotional skills. So it is very important, especially the first year of that child's life. The brain, that's the time where it's, you know, um, becoming, where it's evolving, right, the most at the first year of the child's life, right? It's a very, very important, right? It's a very important time for the brain's growth. Protective factors, family. Benefits include emotional support, security, and love, right? Better emotional regulation. Stress buffering offers a reassurance, healthy role models, sense of belonging and identity, practical help, guidance, and coping skills. So, not all families provide support. When family relationships are unhealthy, other supports like friends, mentors, teachers, or counselors can also act as protective factors, right? But it's important that when someone feels that they are loved, that they have a safe place to go to, that they can talk to someone, they're able to process better, right? And they're able to reach out for help, right? Instead of being judged and feeling shame and feeling guilt, it's important that, you know, as families, we can provide the support even when they're not doing, when our loved one is not doing the right thing, that we can help support them through the process, right? Because recovery is a process, right? And everyone has a different pathway and a different, different at different times they want help, right? So we have to be supportive throughout the journey because it is a journey. Protective factors, communication benefits include reducing emotional buildup, clarifying confusing thoughts, feeling understood and supported, sharing burdens with others, reducing feelings of isolation, building strong and social supports, and feeling less alone. So family is important, but without communication, it's it's like you don't have a family, right? There are people who have beautiful big homes, right? And they don't even talk to one another. There are people that have these huge homes, and so somebody's in the bedroom upstairs and somebody's in the bedroom downstairs, and they don't communicate all day, right? So it is important, more so than family, to have communication, right? To be able to sit down and to be able to talk and to be able to, to be able to um, sit at the dinner table. I mean, how many of us do that, right? Everyone is so busy that we don't take the time to sit at the dinner table anymore and talk, right? So important, so important. Protective factors, right? Balanced diet, adequate rest, physical exercise, drug-free environment. Healthy lifestyle habit regulates neurotransmitters such as dopamine, which is the motivation and reward, right? Serotonin, mood and well-being, controls the mood and well-being, and endorphins, natural pain relief and happiness. So all of these, right, are natural neurotransmitters that are in our brain, right, and they are released, and in our also in our GI tract, and they are released, when we have balanced diet, adequate rest, physical exercise, and so it is important that um, that we incorporate this. It's not just about our loved ones getting sober, but after that, they need to be, they need to have adequate rest. They need to have an adequate diet, balanced diet. Physical exercise is important because it takes your brain at least 2 years to heal. And so when you introduce those things, it's the brain can heal faster. Although it takes 2 years to heal, the brain can actually heal faster if they are in a safe place, right? They are provided with balanced diet, adequate rest, physical exercise. The brain can actually heal much faster. Protective factors, cultural and social factors, social integration, practicing a sport, belonging to a church, a club, association, engaging in spirituality. In the years that I've been a therapist, one of the major things that clients have an issue with is boredom, right? And boredom leads them right back to addiction, right? So it's important to have, so that they connect, right? It releases mood boosting chemicals like endorphins, right? Improves confidence and self esteem, development of teamwork and communication skills. It reduces stress and anxiety, sense of belonging and acceptance, emotional support during difficult times, opportunities for helping others and volunteering, reducing feelings of isolation. So again, it's just very important. Connection with social connection is just um, something that is is imperative. It's imperative because they build new connections, new networks, right? It's important for them to do different things, right? Insanity is doing the same thing over and over and expecting a different result, right? Supports for recovery. Again, addiction recovery usually works best with multiple therapeutic supports, right? Combined. Psychological therapy, right? Medical treatment, social supports. All of these are important, right? And like I said, everyone has a different pathway. I mean, some people may not want to have medical treatment, right? And that's okay. And some may not do well with social supports in the beginning, right? But again, it is important to just support your family member or your friend through the process, through the journey. And any progress is good progress, right? So, therapeutic assistance, dialectical behavioral therapy. These are just some of the therapies that they can obtain in counseling, right, in therapy. Cognitive behavioral therapy, medication assistant treatment, right, group therapy, 12-step programs and peer supports, family therapy. And what are the outcomes when our loved one engages in these types of therapies or group therapy or individual therapy? What happens, right? They assist in managing intense emotions, reduce harmful behaviors, and improve relationships. strengthens the prefrontal cortex for better self-control. It calms the amygdala, less emotional reactivity. It improves emotional regulation networks. It improves self-esteem, and it builds new habit pathways, right? So again, our brains are neuroplastic, and as someone continues to engage in therapy and they listen to other stories, right? So when you're in a group setting, right, and the client is, they're seeing other people that are they're going through the same or similar experiences as them, and they hear the testimony of the other person and how he was able to get out, how he was able to, overcome whatever they were overcoming. It actually helps build resilience within the client, right? So, and they can connect with one another, right? And understanding that they're not alone, right? And so that helps with shame and guilt. Lots of people, they don't want to get help because they feel shame, they feel guilt, they feel judged, right? And so when they find a place where they can speak freely, right? They have a safe place where they feel safe, that they can speak to someone that's not going to judge them, then they can overcome, right? They can continue to make progress, right? And there may be a setback because relapse can be part of the journey, right? It's not the end all and be all, right? But knowing that they can come back to, you know, a place where they're not going to be judged, that they have an open door where they can continue to get help on their journey is huge. It's huge. And so when they make these connections, they usually remember, they usually keep their, their, on their cell phone, they have their therapist number, or they have crisis hotline. So at outpatient, when someone discharges from the program, we give them a packet, a discharge packet, and we provide information in case of a trigger, a craving, or a relapse, and we, you know, basically let them know, listen, if you ever need help again, we are here, right? And so, for you loved ones, that's what that's one of the messages that I want to get across today is you want to make sure that that they know that you are there. You are there no matter what, right? And understand that this is a disease, right? Substance abuse is a disease. Mental health, right? There's a DSM for a reason, right? There are diagnoses that need to be treated. And some of, it could take a lifetime, right? So continuing to support, and continuing to come to sessions like this so that you can understand, so that you can better support is crucial. It's crucial. All right. Thank you. And that is all for tonight.
Thank you so much. If anyone has any other questions, you can email us at familyservices@promises.com. Once again, we'll be back next Tuesday. Great question. Are the slides available? We will send you, if Nalita is open to it, we can share these with you in your CE Go dashboard. So the same dashboard that you used to join this, you'll get, they have some places where you have resources, and so we can list those there. And yeah, if anyone has any questions, we're around. Thank you for being here, Nalita. That was wonderful. And you all have a great rest of your evening. Thank you so much.
Thank you.